representative of the Honorable Minister of Labour, the National President of the Association of Nurses and Midwives, NAM, members of the High Table. I'm very excited to represent the United Nations Population Fund, UNFPA, in this goodwill message. As an obstetrician, I am excited by the work the nurses and midwives they do. Today, I actually made a tweet on Twitter and my Facebook saying that there are two important days in a person's life. The most important days is when you are born and when you know why you were born. And the midwives are critical in ensuring that the very first day, the very important day of your life, not just happen, but that you have, mothers have a thrilling experience, and they do so well. The United Nations Population Fund, UNFPA, is a reproductive health and right agency of the United Nations. And our work, especially in Nigeria here, is to deliver a country where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. UNFPA was born in 1969, so this year is our 50th anniversary. It's our golden jubilee. And this golden jubilee, we intend to ensure that, one, that all maternal deaths, preventable deaths are eliminated, an end to all maternal deaths. That's the first one. And an end to unmet need for family planning, and an end to gender-based violence, including harmful practices like child marriage and female genital mutilation, which have a great impact on the health situation of girls and mothers. For us to achieve these transformative results, midwives and nurses are central to achieving the result. We cannot do it alone. Central to achieving it, we know that nurses and midwives are there. We understand very well that nurses and midwives are heroes. They are public health heroes. Clap for yourself. You are heroes because you ensure that the well-being and health of everyone, especially women and children. You ensure that every pregnancy is healthy, every childbirth is safe, and that the newborn receive the essential care that they need. And these are the critical and basic fundamental human rights. So you are defenders of human rights. Clap for yourself. Educating and enabling nurses and midwives is the smartest, cost-effective, and sustainable way that will bring us closer to achieving universal access to sexual and reproductive health and universal health coverage. This is a crucial target of the broader Agenda 2030. For us to achieve it, we cannot achieve it without nurses and midwives. This year is also a year where we are celebrating the 25th anniversary of the International Conference on Population and Development held in Cairo in 1994. It's a very critical landmark because it is that time that the world leaders, all countries in the world agree that population and development were closely related, they are linked, and that sexual and reproductive health is a human rights issue, and that we should address it from the human rights perspective. UNFPA actively promotes the midwifery education, training and support, and advocate for stronger workforce and integration of midwives and nurses into the formal health system. In more than 120 countries we work to ensure that midwifery curriculum are aligned with the global standards, and that midwifery schools are strengthened, and we also strengthen the capacity of midwifery tutors. At the same time, we work with midwives and medical associations to create an environment where midwives are central to the health services and are seen by mothers and health professionals as crucial part of the health system. UNFPA, the World Health Organization, UNICEF, and the International Confederation of Midwives will be launching a report. This report is called Strengthening Quality Midwifery Education and Universal Health Coverage, 2030. And this report presents compelling evidence that training of midwives, supporting them and integrating midwives into the formal health system is one of the best investments that we can have, and that it is the only way we are going to do to achieve the universal health coverage by 2030. Today, as we celebrate the International Day of Midwives and Nurses Week, I urge the government, development partners, and all the citizens to join UNFPA in supporting midwives and nurses. Let us show our utmost appreciation for the tireless work that they do, helping them to ensure reproductive rights and choices and safeguard the health and well-being of women and babies in Nigeria. Midwives and nurses save life. I wish you a happy celebration of the International Day of Midwives and Nurses Week.